And now tonight to some new details about Omicron and the COVID-19 vaccines. Omicron appearing to be more resistant to those COVID vaccines, but it's also not making people as sick as the Delta variant. At least that's what a new study from South Africa found. This comes as we get new insight about the virus from the CDC director. And we also mark 1 year since vaccinations began around the world.
So much excitement and overwhelming emotions that day had come at that point, after the challenges of the first 9 months of the pandemic, to know that there was hope.
As healthcare workers across North Carolina take a look at the progress we've made since those first COVID-19 vaccines arrived 1 year ago.
In the past year, we've administered more than 12 million vaccine doses and almost 2 million booster doses.
They're also looking forward. The newest variant, Omicron, is spreading quickly throughout the world.
It is more transmissible, and we're seeing that in other countries as well, that it's rapidly becoming the more predominant strain.
Health officials continue to push North Carolinians to get vaccinated, especially one particular age group.
I'm concerned about our younger population. They're the least vaccinated, and it's where we're seeing the highest rates of cases.
Take a look at these numbers from the state. 17% of 5 to 11-year-olds have received at least one dose of the vaccine, less than half of 12 to 17-year-olds, and around 52% of North Carolina residents 18 to 24 are at least partially vaccinated. And so we wanted to dive a bit more into that first major real-world study on Omicron. So here's what we know tonight. South Africa's largest healthcare administrator did this analysis. It found on average 29% fewer people went to the hospital compared to the Delta variant. The study also found 2 doses of Pfizer gave 70% protection against hospitalization, and that's compared to 90% seen during the Delta wave. We should note, however, that the findings are preliminary and they aren't peer-reviewed yet.